Well, good evening. Welcome, everyone. This is Dr. Ellithorpe. We're at Tustin Longevity Center here in Southern California. And we meet here every Tuesday from 6 p.m. until 7 p.m. We talk about health related questions, symptoms, how a functional, integrative, anti aging doctor would approach certain symptoms. And we try and give you an idea of what our thoughts are, how we're looking at your symptoms, and what we're thinking about. uh, this is not meant to be medical advice over the YouTube. So if any of you are seeking advice, we ask you to see your private doctor or see one of us clinicians here at TLC if you're one of our patients. Nevertheless, we can talk about the symptoms. We can talk about how we think and would approach them both medically and with natural supportive measures. So, with that, we have two ways of getting a hold of us. One is with our email questions. If you want to type in a question to me, get on our newsletter. That's at tlcdoctors.com, tlcdoctors.com. That's plural for doctors. And then you'll get a notification of these meetings. There'll be a link there, and on that link, on your reminder of the Tuesday night talks, you can type in your question. A certain amount of characters can be typed in, and then get that tribe and get it by 4 o'clock, because they try and print them out around 5:15, and get them to me. This is after a long day of work, so I'm always tired, but I always like to do this so that you have another opportunity to learn, think, communicate, and take charge of your life, take responsibility for your life and your health to the best degree that you can. And we want to be there to help you to do that. The other way to get a hold of us is to, if you're on YouTube, you can link into the chat. We have a chat here, and then you can type in your question. We're starting to get some questions from the live audience already. So it looks like Mono Up. I don't know how to say that name, but you're from Woodbridge, Connecticut, I guess. So welcome to you. You're 9 o'clock there. So you're all the way on the other coast. We're about 5 miles from the coast here. So there you have it. All right. So we do this every Tuesday night. If it's a help to you, if you enjoy this, if you like hashing through some of your uh, anti-aging, preventive medicine symptoms here, and you like this, please hit the like button and subscribe and share it with family and friends. And we'll do the best we can to answer all the questions. I'll start with some of our emails tonight. Mono says, is there a remedy for idiopathic pulmonary fibrosis, IPF? Idiopathic pulmonary fibrosis is usually an older adult age disease. We don't know the cause of it. Idiopathic means we don't know. And fibrosis means scarring, fibrin being laid down. So if your lung is starting to scar and we're not sure why, and this is usually in an older adult, uh, we usually are trying to slow it and treat symptoms rather than knowing any cure. So you would have to have a pulmonologist and be followed by a specialist. But we, from the alternative integrative functional medicine, we would say whatever is creating fibrin and elastin to be laid down in the lung tissue areas is scarring, and scarring will only really show up where there's chronic inflammation or irritation. So, of course, if you're smoking, if you're vaping, if you live in an area that is polluted, if you live near a highway within a mile or so of a busy highway, like a 4-lane highway, It's been shown that there's increased pulmonary diseases alongside of highways and in um, urban city dwellings. That is the oxidative stress of the exhaust from petrochemical burning, heavy metals that are associated with it, the airports and pilots. I used to be a flight surgeon, being exposed to JP4 jet fuel and the metals that they put into this so that it burns smoothly in combustion rather than having backfiring. So you don't want your airplane to backfire, and the template upon which the ignition of a burn or explosion of a fuel occurs is on a metallic basis. So that's why they added lead to gas, so it wouldn't knock. So it's a anti-knocking, anti-backfiring agent. So people who live around these industrial polluted areas, then there's all the other pollutions, whether it's the plasticizers or other petrochemicals that are in there. You want to think about wearing clothes that are made of petrochemicals, and you would want to wear things that are all natural cotton underwear, and get away from all these polyesters. These are microplastics that can create irritations. You have to stay well hydrated. You should drink half your weight in pounds as ounces of water. To treat some of these airborne toxins, not to mention pollens, or if you're in a very arid, dry environment or a very humid, you have other issues such as uh, down here in the southwest United States, we have the valley fever and some of these spores that get in the dust. And when the dust gets kicked up, we breathe them in. If you're living in a very wet environment, you might have more molds to be concerned about that are irritating and inflaming. If you're a diabetic and your blood sugars fasting are much above 85, let's say, or if your hemoglobin A1C is much above 5.3, or if your insulin fasting is much above 4, or your triglycerides are much above 50, you're going to have more trouble with oxygen and blood flow through the tiny capillaries. So you don't want to be dehydrated. You don't want to have a lot of sugar, carbohydrates, starches in your diet, making your blood thicker. You want to have plenty of water. You don't want to have food allergies. There are foods that can create immunoglobulin G type antibodies, the slow reacting antibodies of a leaky gut. Most Americans have some form of leaky gut, even as a youth. If you're a blood type A person, you will digest less well as a general rule. Some A's are worse than others, but as a rule, A's don't digest as well, so they don't extract the amino acid proteins and fats as well, so they don't reconstruct their cell membranes as well. And the same goes for their tissues of their lung and skin, and hair and so forth. So if you're a blood type A, that would have an implication. We would put all those people on a digestive enzyme with betaine hydrochloric acid whenever they eat food. The way we treat idiopathic pulmonary hypertension here is we insist they see their specialist, but we come alongside and we do EDTA chelation, high dose vitamin C with a methylated B complex and multi mineral albion chelated minerals that are put into the solution with EDTA, ethylene diamine tetracetic acid, and high dose vitamin C. So it acts as an antifungal, antibacterial, antiviral. The EDTA improves nitric oxide synthetase activity, and there's more vasodilation and better microcirculation. It pulls out the irritating air pollutants, lead, aluminum, mercury, and so forth. The B vitamins are associated with, along with healthy nutrient minerals like zinc and magnesium, to relax smooth muscles and to help be cofactors and a myriad of metabolic functions that the body has to perform. So we do chelation. The vitamin C helps fight off so many uh, viral, bacterial, fungal, infectious issues. We usually use systemic enzymes to help prevent any microclotting and inflammation. We usually tell them to elevate the head of their bed about 15 to 20 degrees. I would buy, an electric bed that raises you up at least 15 to 20 degrees, a good 15 to 20 degrees. So you're never sleeping flat, because another cause probably of idiopathic pulmonary fibrosis is the unknown silent uh, aspiration of gut fluid that seeps up, and you can have that get into your larynx, glottis there, and become caustic, irritating, and inflaming. Um, the other thing is the magnesium that we give will help with smooth muscle relaxation. The food allergies we screen for, we ask people to eat a very simplistic diet and get away from all this marketing that tells you every time you eat it should be an entertainment for every piece of food you eat. We try and teach eat a one menu day, so the less variety of irritating foods, because all foods have to be digested, broken down. That's work for the body. Then it has to be screened to make sure it isn't coming along with some virus or toxin or poison. And your immune system is stressed every time you eat. The best times to eat would be breakfast and lunches, and not eating after 3 o'clock in the afternoon. Eating a simple menu, have a protein and a uh, cooked vegetable, butter, salt, and pepper. These kind of things would make a good breakfast and lunch. So you could have beef and broccoli for breakfast and beef and broccoli for lunch, and finish up eating by 3 in the afternoon. That'll provide tremendous nutrients and support for your body. If you have grass-fed beef, wild caught fish, prairie raised poultry, and pork, and then wild caught, I mean, prairie raised eggs. All these things will keep your immune system unburdened by a crazy, wild entertainment diet. Stopping eating earlier will help your body to be cleaner, so that when you go to bed at night, there's less aspiration of liquid chyme coming up your throat, less work to do, and your body will be better organized and relieved to repair your body at night, so you live longer. Exercise, resistance training, and circulatory aerobic training are very important for idiopathic pulmonary fibrosis. And then there are, that helps you with breathing treatments. There are treatments or exercises, pulmonary therapies, that help you to learn to take a full breath and to expand your lungs, because most people are too tense and don't take enough deep breaths during the day. I find that when I do my heavy weightlifting 3 times a week for 45 minutes, I find that I'm yawning often. And that's an indication that I'm not taking enough deep breaths and retaining CO2. So, exercise is a good reminder and help to expand your lungs and to use every part from the apex down to the bottom to help you with that diaphragm exercise and getting the air moving. The other thing that I would say is taking anti-inflammatories besides systemic enzymes and digestive enzymes, because most of us by the age of 60 also need, like a blood type A who needs it from their youth on, but digestive enzymes will help us all digest our food so it gets out of our stomach and we don't lay down with food burping up or seeping up into our throat. Um, but systemic enzymes. And then N-acetylcysteine is called Mucomyst. It was marketed originally as a anti-Tylenol overdose, Tylenol poisoning, acetaminophen with liver damage. But they also found that it was very helpful in lung and helping with expectoration, coughing up phlegm, and with lung performance. Another thing was iodine. Iodine helped loosen up lung phlegm and expectorate it, cough it out. So these are various things that we would suggest that your environment, your air pollution, how close you live to air pollution, even a very moist and moldy area or a very dry, windy, dusty area. All these things are known irritants to the lung. Dehydration, a high carb diet, a high fructose, fruity tooty smoothies used all the time. Uh, so sugar aggravates it. So we would want to eliminate food allergies and eat a more simplified menu. And then exercise will help lung performance and function. Doing EDTA chelation will help to detox and improve microcirculation throughout your whole body, not just your lungs, but it'll improve the oxygen exchange in the membranes. The enzymes will help disinflame the body so that you're not tending to lay down fibrin as much. And we use natural hormones for therapy to help testosterone for your diaphragm muscle, your heart muscle, your chest intercostal muscles, all your muscles with your exercise. We use the natural estradiol in women and progesterone, elevation of the head of the bed. All these things, along with your pulmonologist making sure that your blood pressure is not too high and giving you other medication that may be warranted and helpful. So this is how we would uh, try and improve idiopathic pulmonary fibrosis. And Mano, I hope that's a help to you. All right. The next question is from Joanna. She says, "Hi, Dr. Ellithorpe. My dentist is saying that I need a root canal. It will require antibiotics beforehand. What can I take to detox from the antibiotics? Do you know of any other options other than a root canal? I have heard of a lot of people removing root canals. I would appreciate any guidance you give." Well, not infrequently, a lot of us had, the silver amalgams for cavities from the 1950s, 60s, and 70s, and so on. And then these cavities, then the tooth will expand and contract with hot and cold, and it'll loosen from these crowns and these amalgams. And then bacteria and material will get under that, and it'll start eating at the dentin of the tooth and infecting it, which will give you pain and soreness, and the crown might fall off. And then they'll find that this infection has started going down one of the roots of your teeth. And you have to understand the construction of a tooth is just a bunch of tunnels, the little air tunnels. These are the little canals that make up the structure of the tooth. Uh, and the enamel is supposed to protect the tooth from invasion of the bacteria or irritants. But this often through life, a broken tooth, trauma, hot, cold all the time will in fact irritate the gum line too. And then you'll get infections through the gum line as well. So good oral care. But I'm of the persuasion that root canals are very dangerous and usually associated with prolonged low grade infections that can linger and then get into the bone, and in the bone then create these abscesses, which are linked with other diseases: breast cancer, prostate cancer, heart disease. Every time you chew, you're going to express that poison, that abscess, that however tiny it may be, you'll be squirting thousands, millions of bacteria into your bloodstream. And I'm sensitive to that because that happened to me when I was about 46 years old, 47, 46 years old. I had a wisdom tooth that got infected, and I was just so busy with medicine, I didn't realize it was infected. And I was flossing, and I apparently got it into the bloodstream. By that evening, 3 hours later, I had a very high 104, 105 fever, and I was in rigors, meaning I was shaking so bad from the bacterial infection, I had to be hospitalized. The doctors never asked me what I thought was going on. Of course, I was a little delirious at first, but when I improved the next day, I told them it was after I was flossing. They didn't send a dental consult or anything into the ICU. They did nothing. They just gave me antibiotics and then kicked me out in a day or two. And it was only because I was doing another doctorate in integrative medicine that I learned about uh, all the history of Hal Higgins and his work with mercury and the teeth. And he was finally driven out to Mexico to do his work there, and how dangerous the root canals are. And apparently, I don't think I had a root canal, but I had a infected tooth in the wisdom tooth. It was back there. And so I am against root canals as a general rule, unless you have an extremely experienced uh, uh, endodontist who knows what they're doing, and it can be tracked with a 3D scan where they X-ray you to look for any um, evidence on a scan uh, that there's gas or fluid around that tooth indicating an abscess. In which case, you have to pull it, and then if the bone hasn't been irritated, then they'll put in an implant that is not going to have any canals like a tooth would to grow bacteria. And it appears that implants tend to be much better received and helpful than anything else. So I'm going to say, as far as preventive for bacteria, they're going to give you antibiotics. I would start taking a high dose probiotic. We use here probiotic 225. It's a powder, and one packet has 225 billion per packet. It's a once a day dosing. I would certainly use that after any antibiotic dosing for any reason, be it a urinary tract infection, earache, lung infection, any infection where you had to take antibiotics. I would take 2 weeks of that high powered probiotic 225. Preventatively, you can be taking orthobiotics, which is a step down from that. It's called Orthobiotics Probiotics 100, Probiotic 100. So that's a step down from the 225. And you could use that one a day for many months after any antibiotic. And then if you're still doing well, then you can step down to their lowest price, just plain probiotics, and take one of that all the time. There are gram negative, the E. coli type enterococcal bacteria in a thing called O'Hara's essential probiotics. And very often I find my patients on complete digestive stool analysis missing enterococcal healthy species besides the gram positive ones that are very helpful. So I give them both O'Hara's one a day and probiotic one a day. And that's essentially what I do. So I would take the probiotic now prior to any root canal. If you can get rid of the root canal and just get rid of the tooth and get an implant, it depends on if it's a front tooth or something. Cosmetically, you probably have to have it. If it's just one tooth in the back there, you're going to be talked into by the dentist that your teeth alignment will move. I've been practicing medicine 45 years, and so I've seen a lot of people over the decades and decades where they've had an absent tooth, and I don't see any significant, shifting of their teeth. So I don't know if I can believe that argument. Um, s- Tooth implant, an implant seems to be very well received and safe. It's not perfect because it is a foreign object, but at least it can't grow bacteria in it and infect your body if it's done healthfully. Using Argentine silver, swish and swallow. So that's the nanobacteria, not nano silver. Parts per billion, 23 parts per billion. And if you take a sip of that, swish it, and then you could swallow it or spit it out, whichever you want. It's safe to swallow. And After you brush every night or before the dental procedure is done to reduce the total amount of bacteria in your mouth. And then after the procedure is done, that's another option. Let's see, who do we have on the live questions here? Jenna Silbert says, I'm eating a low carb diet, AB blood type. I drink 80 ounces of water. I walk daily. I'm trying to reduce my hemoglobin A1C naturally. It is 7.4. It was 6.8 before. I did 3 months of intermittent fasting, 16 to 18 hours. Uh, I am now officially in menopause. I went to a functional medicine doctor, Fletcher, and she did blood workup. Everything came back negative, no answers. She referred me to an endocrinologist. Uh, did some women, especially postmenopausal women, not do well doing intermittent fasting? How can I reverse this type 2 diabetes? I'm frustrated, have the dawn effect fasting, blood sugar high in the morning. Uh, my suggestion to you is that you only eat between when you wake up in the morning and 3 p.m. There is tremendous science piling up now for years that uh, the way we should intermittent fast is not skip breakfast, but rather eat the breakfast and a lunch and cut all eating off at 3 o'clock in the afternoon. And that we should take a walk after our meals. A brisk 15-minute walk after a meal will greatly lower any glucose impact. And then, of course, your diet, you have to have a talk with yourself and God about what does food mean to you. If it's your lover, if it's your comfort and emotional eating, for which I admit I've had issues in my life, then you have to talk with God and yourself about what does food mean. It's supposed to repair our body, and I'm telling you, tortilla chips don't do that, and French fries don't do that. So we have to understand we're made of protein and fat, so we should be eating primarily proteins and fats. Uh, Fat number one, protein number two, and very limited carbs. We have a whole industry making money off of us through our diseases and our illnesses because of them making food so addictive, so available, convenience through all the marketing, all the advertisement. And we are being trained to be addicted, to make ourselves ill, to make another industry prosper in medicine, to make money off of our misery. So, number one, stop eating after 3 p.m. Number two, do some weightlifting to build up the muscle mass in your body, because we're losing our muscle mass and we're eating. And so if our muscles are shrinking, but we're eating at a certain pattern, uh, and our muscles can't burn that up enough, we have to understand we got to build up those muscles. So weight resistance training on real weight machines, not little 5 pound wiggle bars, is what we really need to do 3 times a week for at least 30 minutes. I do it 45 to kind of make up for any 30 seconds between machines that I'm in recovery. And lastly, you have to eat mostly as a carnivore, largely, a very rich protein, fatty diet. So these would be the things I would say, and you would probably need a digestive enzyme to help you break down that much protein and fat. And You need the water to rinse away the inflammation in your body, and your body won't lose weight until your insulin is under 4.0, and your triglycerides are under 50, and your hemoglobin A1C is under 5.3, and your fasting blood sugar around 85, essentially. And it takes time, but you're going to feel healthier. You're going to feel less joint stiffness, better mental clarity, better mood. All these things, your blood will be good. And I don't know what they're calling good. Even people who claim they're functional doctors, if they think a fasting blood sugar above 85 is normal, then you're not with a good doctor, in my humble opinion. If they think a triglyceride level fasting above, let's say above 70 is good, they're not a good doctor. And if they think a hemoglobin A1C of 5.3 or higher is good, you want to be 5.3 or less, then you really need to get a better or more experienced functional doctor. So that's my advice, Jenna. And I just want you to understand they have worked very hard to corrupt all the schools to make the kids an obesity epidemic, and get all the school foods this way and stop mothers from cooking at home and making lunches. They have done all of this, and it has harmed our children, harmed our marriages, harmed everything. They've made the food systems and the hospital food ridiculous. Anyone who claims to be a nutritionist or a dietitian today with standard training is not good, in my opinion. I've worked 45 years and I've yet to find a nutritionist dietitian that understands what to do in my exposure. There may be some out there, but it's rare or they're watered down. So I liken it to a good example would be like struggling with pornography. If you commit adultery, and yet you want to preserve your marriage, you want a good marriage, and so you go get counseling, you admit it's not good to have a physical adulterous relationship with someone outside your marriage, and then you say, okay, well, doctor, I won't do that anymore, and I've been successful now 5 years without seeing someone, but I want to continue looking at my Playboy magazines and videos. Well, that's really not solving the problem. That you've just um, uh, painted over it, but the problem is there. We have to get a divorce from this corruption of food and what food means to us. It was supposed to be something wonderful where grandma would make a mincemeat pie or pumpkin pie or pecan pie. And she would bring it to Thanksgiving with her 83-year-old body and what she could do. And it would have been a wonderful, valuable gift to the family meal. But today you can go to any restaurant and get that same pie, and it means nothing to children or to the adults anymore. If grandma, she feels useless. And so we have so dethroned what family time and eating is because of the corruption of all this worship of money and fame and showing off what we're eating, taking pictures of it. I say, shame on you. Don't do that. If you're blessed to have a super duper meal, keep it to yourself and enjoy it. And don't show off that you're a gluttonous by taking pictures all the time of all the places you get to go and eat and make other people who might know you feel hurt or sad. Now, shame on them for feeling envious and covetousness of your success. God blesses you with success. Enjoy it, have it under control. But we have to get this food and this body image, beauty, and masculinity image out of our minds and get uh, uh, loving one another and respecting what food was and what family time is. In my humble opinion, boy, that was a long response, wasn't it, Jenna? Okay, Beth says 58-year-old woman eating keto with total cholesterol 546, HDL 83, triglycerides 80, LDL 447. Your thoughts if this is a problem? Well, I would have to know who you are, Beth. In general, I'm going to say no. If you're truly keto and it looks that way because your triglycerides are 80, I would want to know your fasting blood sugar, your fasting insulin, your hemoglobin A1C as well. But this beautiful balance between your HDL and your triglycerides, they're equal. So you're exercising about what all you're eating, all the food that turns into fat, triglycerides is balanced by what you're exercising off. So I'm going to say this is probably very, very reasonable. Again, when I was on active duty in the 1970s, early 80s, with lots of very healthy people, very little pollution of all the soda and junk food back in 1978 and 1982. I would see men all the time with total cholesterols of 430, 480. That just sticks in my mind. And I don't recall that we were doing so much LDL as just total cholesterols back then. But they were much healthier men. Mickey says, what is oh, message was retracted. Okay, so we missed that message. All right, hopefully that helps you, Beth. I would have to see who you are and maybe do a body mass indice. You know, get your percentage body fat, lean mass, and your hip to waist circumference, and just those few other labs, and get a feel for how you're doing, and go from there. But right off the bat, I have no problem with those numbers. Um, let's go to the next one. Joanna says, hi, Dr. E. Dennis, that was the dental one. We did that. Mary says, my family member seems to have had a miscarriage. She was very early, maybe a few weeks. One day she had a strong positive pregnancy test. The next she was cramping and bleeding. It got worse for several days, seemed to stop, then spotting. Now she's just nauseous. The test shows a negative now. Should she give up hope? Also, any recommendations? Well, you can see your medical doctor and get another type of pregnancy test through the blood for the number of human chorionic gonadotropin number. Is it high or low in your body? Because when you're pregnant, you make that HCG hormone, and that's what they're testing for on the urine strip. But there are other things that can mimic HCG, which would be things like Valium can do it, Xanax can do it, antipsychotics like Thorazine. Uh, so there's psychiatric medications can do this. Some anti-nausea medicines, promethazine can do this. So there's medicines that can cause false positives. There can be stress can cause this. There are certain, abnormal growths that can produce human chorionic gonadotropin, cysts, ovarian cysts. And so if she isn't improved and she's still negative and she's still nauseous, she has to see her doctor. And find out if the blood test she gets for human chorionic gonadotropin, HCG, is a high number, then she has to have that evaluated and tracked, because it should continue to rise at a notable predicted rate, that there's a viable pregnancy still left. I had a lot of cramping and bleeding with Talon, my son, and you could have argued with me that I lost the pregnancy, but indeed, I found back in 1982, believe it or not, I found a holistic OBGYN back there in Chicago Medical School, and he helped me through it, even though I was stressed to the wazoo as a fourth year medical student, and I was able to hold on to the pregnancy, but I thought I had lost the baby. But indeed, we were able to keep Talon, and now everybody knows Talon. So there is hope. You have to see a doctor and find out where it's at. Faith, hope, and love. Remember, the Bible says probably more than any other one phrase, it's been taught, the phrase, fear not, or have no fear. Those two statements appear at least 365 times in the Bible. So fear is the enemy. Faith is the strength of our Creator in healing us and able to handle all things through Christ. So that's what I would say, because cortisol is very um, anti-pregnancy in many of its activities. So think about that. Let's see. Cheryl says, "How can I lower my blood sugar if my cortisol gets high from stress and my food allergies?" You have to get good sleep. You have to have a nice dark room. You have to go to bed around 9 o'clock and let yourself get up 4:35 in the morning. You have to have your exercise and your food healthfully eaten, and get your feet in the little wet grass grounding in the morning with the infrared of the morning sunshine, getting it in, going through your skull, your eyes, and your clothes every morning. That is a good circadian and a good autonomic system recharger. So, infrared light, grounding with your wet feet in the grass in the morning, exercise, getting to bed at a set time every night. About 9 o'clock is when the electromagnetic energy is starting to send out waves globally at wherever you're at 9 o'clock, which will say, get into bed. We're going to release human growth hormone, repair hormones to repair your body. You'll shut it off if you eat or your body has a lot of food in it. That's why you shouldn't eat late. And that will help bring the stress down. Exercise, sunlight, grounding. Stop eating around 3 in the afternoon if you can. Eat plenty of healthy protein and fats. Those are satiating. Use your digestive enzyme if you're getting older with it. All those things will help you with lowering your cortisol level so it won't fight weight loss, health, and rebuilding of your body. John says, "What are your thoughts on hyperbaric oxygen therapy for cancer?" Yes, I would say if you have it by you and it's affordable for you, I would recommend it because the argument is that cancer is a mitochondrial metabolic disease where the energy production is failing in all the little mitochondria engines of the cells, and that will create more free radicals. The free radicals will harm the cell and cell function and the DNA, like terrorists with knives going around slashing. And then the cell, in its defense, trying to survive, will find another modality low in a low oxygen, just like during your first month of life, where you were 1 cell, 2 cell, 4 cell, 8 cell, 16 cells, 32 cells, 64 cells, 128 cells, and so forth. This is a time when you didn't have a unique lung or heart or blood vessels or mouth or brain. You were a glob of cells, and you were very influenced by the dynamics of your mother's health and how well hydrated she was and how nutrient full she was. And you had to get the oxygen from her breathing in the oxygen. And by the time you hit about day 56 of your life, and you implanted into the oxygen rich, bloody lining of the uterus lining, and started making your placenta attachment and the blood vessels there, that's when the pancreas is starting to form, sends out enzymes that help shut off this invasive growth of the placenta into the lining of the uterus. If that doesn't happen, you can wind up getting a very rare chorionic gonadotropin carcinoma, which is a very aggressive and malignant cancer. So you see, Professor John Beard in 1909, in his book on embryology, taught about this and argued that cancer is really just a reenactment, awakening of some of the what they would probably call junk DNA. Probably that DNA was very important in your first 56 days of life before you had the critical elements of your formation. So, yeah, oxygen helps stop the metabolic, low oxygen tension, but you have to do all the other things: drink, eat low carb, stop having a sticky, icky diet, with all the carbs. So yeah, I'm very much in a favor of that. Uh, let's see. Then Mickey says, "Will grounding happen if you have only turf grass?" No, but if you can grab onto the palm of a plant or the leaf of a plant with your hands, the tree's roots will go into the earth, and you'll ground by holding on to the plant leaf that way. But I would make an effort to get on the ocean and get your feet in and ground, at least once a week with the salt water there, or hold on to leaves. Take a walk in a park with lots of leafy greens. There's tremendous amount of infrared there. Touch the plants, touch the leaves, so you ground that way. um, 90 minutes of hyperbaric oxygen treatment sessions at a chiropractor in San Jose is $150. That's awesome. And I would take advantage of it. It's probably associated also with slowing aging. Barefoot in the Garden says, "Hi, Dr. Rita. I live in Michigan, so it's cold, no sun, etc. What do you think about portable infrared saunas?" I think they're very wonderful. In fact, in my bedroom, I have the sauna space, which is like a little tent. And I also have the infrared, no, the, what do you call it? Faraday cage in it. So there's 3 layers to my little tent. I have 4 infrared bulbs in there and a little stool to kind of spin around on. And when I play my Bible tapes or my science tapes or my politic tapes, I listen to that while I'm in there for half an hour, 40 minutes. I take my temperature before I go in. It's, 97.8 or 98.2 or so. And then right after I get out, 40 minutes of doing that, I take my temperature again, and my temperature is always about 100 degrees up to 101. So I know I'm getting tremendous heat shock proteins, vasodilation, energy, improved what they call exclusion zone spacing along all my vasculature. It's just very helpful. Yeah, so that's what I would say. Um, Portable infrared. I use a sauna space, and then they have a separate light. I think I'm going to buy one here, and put it on the on my credenza behind me, so you can all see this light. So that when I'm here, those infrared rays will be going through my skull and through my body all the time, and make up for this junk blue light material that we have. That'll be very helpful. Vicky says, "I'd like to understand what wavelengths are best for reaching the hip muscles and tendons. Infrared, infrared, infrared. The longer the wave, okay, the lower the numbers, the longer the wave, the deeper it penetrates. Uh, UV, ultraviolet means these are very tiny waves. That's why 5G is such a horrible thing, because it's microwaves compared to 4G and the other forms of electromagnetic energy. The longer waves are much better. The microwaves boils your water and cooks your food. So, well, what do you think it's doing to your body? So infrared, that's roughly somewhere in the realm of like 600 to 900 um, uh, um, nano waves per second, I think, something like that, the 6 to 900 wave. And then let's see, I have a device that allows 660, 970, okay, or all at the same time. I think the 660 is probably the better one. Caroline says, "I suffer from migraines. I wake up with head pain. My doctor suggested a sleep study since I always get the headache upon awakening. Could it be related to sleep?" Yeah, you might have hypoxia, low oxygen tension, creating cortisol stress. which is creating a sympathetic tone, and you're not really healing at night and resting. Elevate the head of your bed. I have a pillow, and I take this, pillow about this size, like this, and I put it under my chin. I rest it on my chest, and then I lay my head down and I shove this pillow under here so I keep my mouth shut. There are ways to tape your mouth also. I drink a good deal of water. I do squirt my nose with Argentin, the 23 parts per billion. So I have a nice moisturized, and that's how you're supposed to do it to get good lung aeration. And I always keep my window open a crack for good cool evening air. The cool air in the evening, I try and keep it very dark in my room. So I do very well that way. Um, all right. What type of milk do you recommend if I drink it rarely? Unsweetened, almond, coconut, whole, or 2%? Raw, only raw. If you drink the milk rarely, only buy raw dairy. Okay, period. I am against coconut, almond. I'm against anything processed, 2%. I don't care if they call it organic. They processed it. So pasteurization, homogenization destroys the product. So it's got to be raw. Caroline says, I also use sauna space, but only have one bulb presently. Yeah. Well, that's called the photon, sauna space photon that I want to put on the back here. But they have a tent. Now, the guy, I've been, researching this for decades, since the 1990s. And the creators of sauna space, I think, are the ones that have done the most quality work, cheapest price, and best education for the population. Um, I wear the patented LifeWave patches, which is like wearing portable red light therapy for 12 hours a day. Studies show that X39 and X49 patches worn together form a Faraday cage around you. So great. Well, I'd have to see the science on that, but I do believe in the science of the crystals. And when your body heat, your infrared heat is roughly around 668 nano meters per second. And so that will agitate the crystal in that patch, and that will generate its own frequency. So we are all vibrating, we're all energy, we are all energy batteries. We have to charge our batteries by getting grounded. Get your little feet in the wet grass for 2 minutes a day if you can. Let your eyes sink in the morning sunshine. Try and get a brisk walk every morning. Get a dog to get you out walking if you have to. Those are the greatest things you can do. Uh, Sneaky cat. My niece has been having fainting episodes for the past 5 years, on and off. Her last episode was about 4 weeks ago. The doctors are trying to figure out what's wrong. She has a cold right now, which uh, is making the dizziness worse. She is wearing a heart monitor to make sure it's not her heart when she has fainting episodes. What do you think might be the issue on how to fix it? Thank you so much. I would find out whether she took a shot of that mRNA, Pfizer, Moderna stuff, because that has really messed up the autonomic nervous system. This sounds like postural orthostatic hypotension. Is she drinking enough water? What is her blood type? What is her diet like? What is her fasting blood sugar? What is her fasting triglyceride, fasting hemoglobin A1C, and uh, the other thing, fasting insulin? And then, is she exercising? She has to do weight resistance training. If her heart is not the problem, and she's clear to do that, I would have her do weight resistance training 3 times a week. That'll build up a sufficient tone. She has to drink half her weight in body as ounces of water. And she has to get enough salt, electrolytes into her body. Eat real food, nothing processed. Um, Sneaky cat, God bless you. Well, bless you back too, sneaky cat. Um, the Man Who Wants to Live Forever on Netflix. What about him? Mana Papille, the Man Who Wants to Live Forever. Yeah, yeah. I even think he was taking transfusions from his own adult son. I think he's like 48 or 54, and his son gives him some plasma transfusions. Um, well, maybe he'll be helpful in science. My health and peace is in the Lord Jesus Christ, and I have an eternal perspective. I don't have fear. I think that poor man is so afraid of dying that he's consumed with spending all this money on health and all types of way to improve his biomarkers. I'm more concerned about my spiritual biomarker, and I sin every day. I'm in a fight. The devil's fighting with me all the time to be older and short tempered and crabby. And I have to just fight that because Satan doesn't want any of us to be effective and share the joy and the peace that we have. So I am not perfect at all, and every day I work to not get worn out and feel sorry for myself and abused, and just work for God and give Him thanks, praise and praise and praise. So we have Thanksgiving coming up. Be careful that you don't celebrate Thanksgiving at your mother's house, then your grandmother's house, then your girlfriend's mother's house, and then everywhere, and eat 4 different, 5 different Thanksgiving dinners. That's what's wrong with everything. We are not honoring the day. So everyone has, well, I'm going to have it this day or that day, and eating everywhere and too many meals. Please go to see the people. And if there happens to be, the one meal, enjoy it. But otherwise, please don't get into this endless rounds of leftovers and sugar eating. They want to market you into consuming junk at work, junk at church, junk here, junk there, junk everywhere called food. Please don't do it. And please talk with God about what food means to you and how to eat the real food. I think I have a couple more here on my email. Margaret says, I'm 71. I bought some wild yam cream that Barbara O'Neill suggested. I was wondering if it's safe to use, that it's supposed to be all natural. I think it has diosgenin in it. It's a plant phytochemical that mimics some of the female hormones, but it doesn't replace. It is extremely mild. Dong Quai is another plant phytoestrogen that's in a lot of these formulations that are trying to help menopausal women. I'm not saying don't use it, but I'm saying, why not use natural estradiol, natural progesterone, our real hormone, just like a man gets real testosterone, and use those and have a doctor who's familiar with natural hormone replacement therapy monitor and watch you and use the natural thing. So I don't see any problem with yam cream. I think you're probably wasting your money though. Get the real thing. Jennifer says, if my EKG is normal, good, why would a cardiologist want me to get a CT calcium score done? It is my understanding the radiation from it can cause concern for cancer. Well, an EKG is getting, the electrical, we're all electrical beings. So it's getting the electrical flow dynamics of the heart contractions, which are helpful. But it isn't necessarily diagnostic for predicting a future heart attack. A coronary artery calcium score has been found to have more predictivity of your risk for a coronary artery infarct, heart attack. And so there are many good YouTubes on this. The one I recommend is by a man by the name of Ivor, Ivor Cummin, Cummin. He's a biomedical engineer, and he's been around and was some of the original predictors and promoters of the coronary artery calcium score for cardiac health and safety and preventing heart disease. I mean, we're talking decades ago. So go to the original. Ivor Cummin's coronary artery calcium score. He is absolutely a wonderful man, very intelligent, very science, mathematical predictivity on the number of the calcium score and the likelihood of having a subsequent heart attack found to probably have more validity than any independent factor, such as your cholesterol, your HSCRP, things like that. So that's probably why he wants to do it, and I would recommend that for that reason. So let's see. The next question is uh, I'll go to, well, I think it's 7 o'clock. So I'm going to have to stop here. I want to answer these well. So next week, I'll get to these others from Vivian, Jennifer, Donna, Sally, Nancy, and Ron. Okay. I couldn't get to the last four. And so the Lord bless and keep you, and do unto others as you would have them do unto you. And try not to let your anger and pride rise in you. And have a blessed Thanksgiving. We have so much to be thankful for, especially a God who can still forgive us even when we're old and we still make some of the same mistakes. Okay. Take care. God bless. Like and subscribe if this is a blessing. Bye bye.